Okay, so my speech is on the epidemic we're going through now with prescription drugs and the use and how it's a deadly epidemic. It's something I deal with daily at work. The picture depicts the group of people that is being targeted the most, which is young adults ages 18 to 26 right now. Prescription painkillers now have caused a major public health crisis, and according to the CDC, doctors and prescribers are partly to blame for this due to lack of awareness and education on prescribing guidelines. Today, young adults age 18 to 25 are the #1 abusers of prescription pills, and 68.75% of you were correct when you chose that age group on my survey. I have come to have an interest on the effects and the outcome of prescription narcotics due to a lot of the relationships I've formed at work with patients that I've met and lost in the last 4 years. So I'm presenting this presentation because I've been a nurse and I've been dealing with this at the facility that I work for, and we have an 80-bed facility. Out of those 80 beds, 90% of our community are young adults 18 to 26, and they're addicted to opiates. Out of the 90%, 85% of their addictions began with the use of prescription pills at ages like as young as 12. Some of the addictions started in high school due to injuries, and others started just as they interacted with friends and thought of it as fun. When I hear a lot of their stories, it's almost heartbreaking, kinda, that their lives were headed in such good paths, like college scholarships for football, wrestling, or law degrees they were going for, and they lost everything. More than half of you, exactly 56.25%, were unsure of doctors' contribution to the current epidemic with prescription opiates, and it has been documented that conscientious and well-trained doctors are partly to blame for the rising death toll of young adults in America today due to opiate abuse. When doctors began to look at pain as a fifth vital sign, a new epidemic ensued. What is your pain on a scale of 1 to 10? Is what they would ask, and ibuprofen, Aleve, naproxen, the normal medications they would give as anti-inflammatories for pain, became secondary to oxycodone, OxyContin, and hydrocodone. It is thought, the National Institute of Drug and Alcohol states that 2,500 teens in the United States a day try opiates to get high, and 60% by the age of 15 now abuse opiates. On this slide, it shows that young adults 18 to 25 are the biggest abusers of prescription opiate pain relievers. Also other meds like the stimulants, Adderall, and stuff like that to stay awake in the study. It shows that there was out of 24% of 3 age groups tested, 12 to 17, 18 to 25, and 26 and older. You see 18 to 25, 12% out of that 24 were 18 to 25 that use opiate medications for non-medical uses, just to get high basically. And then the motivation for the use is to feel better, lose weight, sleep, relax, deal with problems, study, or relieve pain. Nothing that it really should be used for. So now I'm going to show you a video on some of the social influences that are driving this new epidemic.
Every 19 minutes, a person dies from prescription drugs.
Tragedy, 9 students dead, all tied to drugs.
So in Ohio, 1,300 people died from accidental drug overdoses in 2009. That's more than died in car crashes.
When their son, Chris, died from drug use.
2 months from an accidental overdose. Was on the floor, non-responsive.
Everybody gets high sometimes, you know.
What else can we do when we're feeling low?
I took a pill in Ibiza to show Avicii I was cool. You're gone and I gotta stay high all the time to keep you off my mind.
It's super easy to get drugs. I don't think they realize how big it is.
How bad is it?
Teenagers in growing numbers have been using their parents' prescription drugs to get high.
Explained the thrill of trying drugs morphs into addiction.
1 in 20 people over the age of 12 take prescription medications in a way that's not prescribed.
Is that prescription drugs like Oxycontin, for example, are very addictive and alter the brain chemistry of those who use it.
Administration's new National Prescription Drug Abuse Plan, the first comprehensive federal plan for controlling the intentional misuse of these doctor-authorized medications. It includes retraining 1 million doctors on proper prescription practices, creating databases to track prescription painkillers and other controlled drugs, educating the public about the danger of prescription drug abuse, and stepping up law enforcement.
Okay, so over the last few years, doctors without much education on what long-term opiate abuse will do to you had started to prescribe opiates for pain in obscene amounts, with refills just uncontrollable.
You have to use the mask to click out of it.
Okay,
Yes.
to get back out of it.
There you go.
Okay, so on this slide, it shows the amount of prescriptions and the change from 1991 to 2013. The blue line indicates the total number of scripts written, and these are in the millions. So in 1991, it was 76 million scripts written for opiates. In 2013, it was 207 million, a dip from actually 2012. But the red line shows the amount of scripts written for hydrocodone, and it wasn't green, but yellowish is oxycodone. And in 2013, 53 million for the oxy and 124 million for the hydrocodone. This slide shows the consequences of the use of the opiates that has increased over the years. In 1999, 418 people died from opiate abuse, which is young adults 18 to 24. And in 2014, 1,741 died, which is like 5 people a day. And for every 1 death, there's 119 emergency room visits and 22 treatment admissions, like rehab treatment facility admissions. So to try and get a hold of the issue that we have now with prescription pills, there's new medical guidelines where they're not to prescribe opiates at the first sign of pain. You are to use other things like Motrin and Aleve. They are not allowed to give more than 30-day script, no refills. Schedule II drugs can only be given 5 times in 6 months, and now if they're given longer than that, prescribers have to give proper reasoning, ensure that the person has been made aware of all the effects that could come along with long-term use, and follow federal guidelines and restrictions. So the abuse of prescription drugs among young adults is on a rise, and it's a danger to our youth nowadays. And as parents, adults, and caring citizens, we need to be more better on how we educate on the imminent outcome of opiates. That's it. Oh, I thought it was you raised your hand. Oh, okay. When I talk to think about my patients and the stories of their life, my first thought is that they're able to beat the addiction that they fight with every day before they pay the ultimate price, which is with their life. I feel like it would do them a great deal of justice to be able to go, and other people go into schools, middle schools, high schools, and to be able to tell their stories of the outcomes, the issues, and all the things they deal with addiction on a daily basis. And whether it's illicit or prescription drugs, the outcome's still the same. So I feel like with proper prescription guidelines and better education, we will be able to save lives.
Good.